Governor Sisolak wrapped up his latest COVID-19 response update just a little while ago, announcing a statewide pause in response to COVID-19 numbers rising, but he is not imposing any shutdowns. 8 News Now reporter Vanessa Murphy was listening in and is standing by with the latest on this. Vanessa.
Sasha, the governor is trying to take a more targeted approach with what he's calling this 3-week pause, as you mentioned, to avoid another shutdown. He calls what's happening here in Nevada with the COVID-19 numbers a wildfire, and he's saying hopefully newer restrictions will help get these numbers under control. This all goes into effect on Tuesday. So here are the big takeaways. Number one, places considered high-risk areas have reduced capacity from 50% to 25%. That includes gaming, restaurants, gyms, museums, and additional places. Number two, he says Nevadans should wear a mask indoors and outdoors when around other people and even during private gatherings. Number three, he says there are restrictions on private gatherings to 10 people or less and only 2 households. Here's what he had to say.
There is a light at the end of this tunnel, and we are getting closer. But we do not have a vaccine yet. There's no doubt that this surge is a global and national problem, but it's our problem as Nevadans to fix what we can fix within our own state.
As far as enforcement, Governor Sisolak seems to be leaving this up to local jurisdictions. He also referred to agencies like OSHA, which investigate if they receive complaints and issues are reported. Here's what he said when I asked him about enforcement of these new rules. How do you plan on enforcing, for example, limitations on private gatherings and also this stronger mask mandate you're referring to?
Well, we are certainly not the mask police, but I have done everything I could to help spread this virus. It's now incumbent upon all of us as residents of Nevada to do our part. I hope that people understand the science that we're dealing with, the medical and healthcare realities that we are dealing with, and that they will comply with the directives that are in place.
Now, Governor Sisolak says brothels, strip clubs, day clubs, and nightclubs must remain closed. Places that are not seeing additional restrictions, though, hair and nail salons, massage places, and spas. So again, Sasha, it's a targeted approach. We are seeing record COVID-19 numbers here in Nevada. Governor Sisolak is saying, look, let's take these 3 weeks, see if we can get it under control. If it is not under control after these 3 weeks, he is not ruling out another shutdown. But again, he is trying to avoid that because, again, he has to balance the public health and the economy. And that first shutdown had a devastating effect on our economy since we rely so heavily on tourism. Back to you.
Yes, Vanessa. And Governor Sisolak spoke about the danger of hospitals being overwhelmed, which of course is one of the main concerns when COVID-19 cases spike. So could you speak a little more about the struggles hospitals are facing with an influx of patients?
That's right. We actually heard about this Friday during a call with the COVID-19 director for the state. An issue is healthcare staffing, and Governor Sisolak mentioned this during his press conference today. You have to think about healthcare workers possibly getting sick, their families, their loved ones, whether they have to quarantine. So right now, healthcare staffing is an issue. They are asking for volunteers through the Battle Born Medical Corps. I'll send it back to you.